Oh, thank you. You know, vaccines, we understand, are not a panacea given crisis situation in Michigan right now, but some public health officials, including Dr. Gottlieb over the weekend, are saying that the administration probably should have surged vaccines to Michigan 2 weeks ago when the data started coming in. Can you address that? And what is the argument against doing this, as well as what specifically are you doing on monoclonal antibodies to the state? Thank you.
Great. So why don't we begin with Dr. Walensky, since I think appropriately, as we've said here repeatedly, our goal and our job is to follow what the science dictates the right approaches are.
Thanks, Andy, and thank you for this question, Heidi. You know, when there are different tools that we can use for different periods of when things are when there's an outbreak. For example, we know that if vaccines go in arms today, we will not see an effect of those vaccines, depending on the vaccine, for somewhere between 2 to 6 weeks. So when you have an acute situation, extraordinary number of cases like we have in Michigan, the answer is not necessarily to give vaccine. In fact, we know that the vaccine will have a delayed response. The answer to that is to really close things down, to go back to our basics, to go back to where we were last spring, last summer, and to shut things down, to flatten the curve, to decrease contact with one another, to test to the extent that we have available, to contact trace. Sometimes you can't even do it at the capacity that you need. But really what we need to do in those situations is shut things down. I think if we tried to vaccinate our way out of what is happening in Michigan, we would be disappointed that it took so long for the vaccine to work to actually have the impact. Similarly, we need that vaccine in other places. If we vaccinate today, we will have impact in 6 weeks, and we don't know where the next place is going to be that is going to surge.